everyone. I'm really grateful for the opportunity to present my findings. My name is Anvi Kalyana, and I will be discussing the serious effects of mental health on global health. I'm a rising senior from Herndon, Virginia, interested in the intersection of artificial intelligence and mental health. I am currently doing research at Virginia Tech in which I'm developing a novel model to detect cyberbullying on social media. I'm the captain of the Science Olympiad team and the president of the Girls Who Code Club. I'm also a Dr. Bears ambassador at the Children's National Hospital in Washington, D.C. In my free time, I love to participate in Kathak, a form of Indian classical dance, and I enjoy discussing how art can have a profound effect on mental health in my podcast. In the future, I hope to positively impact those suffering from mental health issues globally. According to the Global Health Center, mental and behavioral disorders contribute to about 22% of global illnesses. Especially over the past few years, the pandemic has aggravated the already grim mental health crisis worldwide. One of the causes of this heightened issue is that time in isolation has forced many people to turn to social media to communicate and socialize with others globally. When people are forced behind their screens, they do not feel as accountable for their actions, which causes several instances of cyberbullying. And it impacts the victim's mental health severely. While some people are able to easily access resources to improve their condition, other communities and countries have a strong stigma of speaking about mental illnesses. The most common places where cyberbullying occurs is on social media such as Facebook, Instagram, Snapchat, or TikTok, over text messages and messaging apps, instant messages, direct messages, and online forums or chat rooms, message boards such as Reddit, email, or on online gaming communities. For over a year, I started working with Dr. Liu and PhD student Mr. Zhang, who conducts research at the Singhani Center for Artificial Intelligence and Data Analytics at Virginia Tech. I reached out to Dr. Liu because of his previous research where he applies artificial intelligence to social media. We started working on a project to detect cyberbullying on Reddit using machine learning. This project really stuck out to me because as a teenager, I know how harmful and destructive social media can be. Despite its effects, social media has a significant hold on our lives. So I'm hoping that our project can lead to a safer online platform. I've seen the derogatory and harmful messages that people send to others without considering the adverse consequences they can have on the receiving end. The avenues for bullying and the rise of cyberbullying on social media presents a unique opportunity to make a difference with both technology and social programming. So why technology? Technology allows you to address the issue in a more automated and scalable fashion. However, it's not a complete solution. Social programming paired with the right technology approach can really foster community growth and participation. And with the right process, mental health due to cyberbullying can be mitigated. In particular, neural networks have gained a big momentum in the space of natural language processing, more so for the reasons stated on the slide. There are several embedding and training models developed by Google and Meta, which implementations help detect the good and bad that takes place in electronic communication. I will briefly touch on how the process is assembled at a high level. First, the collected comments are manually labeled as bullying or not based on the definition of cyberbullying. After the initial extraction and processing of the data is completed, different embeddings and training models are used to classify if the comment is considered cyberbullying or not. In embedding, several embeddings and methods are available. There are several embedding techniques available, of which I've used word-to-vec and sentence-BERT embedding. In this step, the data that goes into the model needs to be cleaned and run through an embedding model. This model translates text data into a numerical representation that the classification model can read. In the training model, based on my research and as a first first step, I decided to use LSTM and GCN models for their advantages. Given the embedded data and any other numerical information with labels, we train and test a classification model. Once trained, the model will be able to classify new examples of cyberbullying. Once the desired information has been turned numerical, it can be structured in different ways when being fed into the classification model or models. Two main ways are a table or a graph, and whichever one is chosen will influence what kinds of models can be used for classification. Graph storage aims to reduce the high dimensionality of the data by only keeping information about the relationship between posts. These are different combinations of embedding and training models that are being approached, and here are a few sample runs or iterations. This one has a 90.6% accuracy. This one has a 91.9% accuracy. And this one had a 92.2% accuracy. So from the above trial runs, it's quite apparent that the SentenceBERT or SBERT model performed the best, given the amount of labeled data. Implementation of models such as these or better would enable detection of cyberbullying to further curb and improve mental health. Similar implementation and detections in every part of digital communications can further lead to issue detection even before disaster can take place. As a part of my future work, I would like to examine hybrid model approaches by having several classification models with an intention layer to predict cyberbullying or not. To further tackle the problem of mental health, I'm currently working on promoting art through my nonprofit organization called the Dance Utopia, in which I use dance as a way to help alleviate mental health issues. Finally, my acknowledgements go out to Dr. Liu and Mr. Zhang for providing me an opportunity to learn and further continued support in my work to make a difference. If you have any questions, please reach out to me using the contact information on the slide.